AI could help us, and then we can send that to your doctor and say, what do you think? And it can all come together. So
And ultimately, it's going to help more people quicker.
yes.
And save the NHS
Oh,
hundreds of millions of pounds, I'd imagine.
hundreds of millions of pounds. The amount of money we're wasting right now because our system is so segregated. Each hospital, each site is doing something different. Even if there is one site that is saying we're doing something revolutionary, well, that's great, but what about the rest of the country? Where's the communication with all the other NHS sites? So what needs to happen is everyone needs to come together instead of doing something separate and say this is a national solution now that we have for everybody.
You know, not being part of the health system, I would have assumed they were already doing that. It's rather scary, isn't it?
No. I mean, I could tell you some horror stories, Brian. I mean, this one particular patient, she came to me for a gallbladder exam, and I actually asked her, I said, can you bring in all of your previous reports? Doesn't matter where they're from, I just want to see all of them. So she brought a stack, and I actually sat and looked through all the stack of her exams, because each exam, and it was the same thing, but was saying something different every single time. So she came to me in Harley Street and said, okay, well, let me do your exam. And what they all had said was that, oh, she's got stones, but the stones looked a bit funny, and every time they were describing different amounts, it made no sense. I said, has anyone ever turned you on your side and tried to see if these stones move? Because stones move, cancer doesn't. She said, no. I said, can you please turn on your side? Had her on her side. This thing didn't move. It wasn't a stone. Then I noticed there's some blood flow going in there. So all I did was I looked at all of her previous reports and said, something isn't making sense. And I took a little bit of more time. It wasn't that hard as a practitioner to give her the diagnosis that I did. And then eventually she went to get that checked out, and she's very thankful, of course. But it was scary that she was having all these other exams done, and none of the other practitioners knew what was done before that. So they were all repeating the same study every time.
That's a big problem.
And this is happening all the time. Now imagine with ultrasound, okay, you repeat an ultrasound, there's no radiation, but there's patients that are getting repeat CT scans. That's a lot of radiation going into the body. That itself can cause cancer. So we don't want patients being repeatedly exposed to radiation.
Yeah.
So there has to be one national system, one national health record eventually.
Yeah. So just before we wrap up then, I just want to go back a little, just backtrack a little way to the mobile technology that you were talking about before, because you mentioned that you do a lot of work in Harley Street.
Yes.
But also with high profile clientele. I imagine these are the types of people who perhaps just don't have time. I mean, you always make time for your health, but really some people don't. They don't have time. They're too busy. I can imagine we're filming here at Pinewood at the moment that some of the high profile clientele that come to these studios and all the other studios around London, they would find that sort of mobile technology where they don't have to lose a day. They can actually lose an hour where an expert like yourself would come out with some of this mobile equipment and help them out.
Absolutely. I mean, we get celebrity clients all the time in our clinic in Harley Street, and it's not easy because at the end of the day, they're still coming all the way there. They're having to wait, having to see us, whereas we could easily come into film studios like this here, bring in equipment, and somebody's got, they injure themselves, they want to see what's going on. We can easily take a look right there and then. And this is going to happen not just for celebrities, but even in let's say, care homes, where there's older patients that cannot physically walk, or they don't want to physically walk. So this applies to a multitude of avenues.
Super.
Yeah.
Ankita, thank you so much. It's been fascinating. We'll be back with more stuff on Pinewood TV.